Have you ever stopped to think about how you sleep? Most of us have a favorite position we curl into without a second thought. But that position does more than just feel comfortable. It's a critical part of your health. The way you arrange your body can affect back pain, acid reflux, even how well your heart functions, and how efficiently your brain clears toxins. Think of it as a nightly health checkup. You choose how your body recovers for the next day. Understanding your sleep posture is the first step toward better rest. We spend about a third of our lives asleep. That's a huge amount of time to be in a position that might be straining your neck or putting pressure on internal organs. The good news? Small intentional adjustments can unlock a higher quality of sleep. In this guide, we'll explore the most common positions, back, side, and stomach, and the pros and cons of each. You'll get practical, expert tips to optimize your chosen position. Let's get started. Sleeping on your back, known as the supine position, is often called the gold standard. When you lie flat on your back, your head, neck, and spine can rest in a straight line. Neutral alignment. Imagine your skeleton perfectly supported on a medium-firm mattress. It avoids unnatural contortions. This alignment is fantastic for preventing neck and back pain. For heart health, lying on your back keeps your head slightly above your heart, which can reduce pressure and improve circulation. Gravity also helps keep stomach acid down, reducing nighttime reflux. However, back sleeping can worsen snoring and obstructive sleep apnea because gravity may collapse the airway. If you or your partner notice loud snoring or gasping, consider another position. To optimize back sleeping, place a small pillow under your knees to support your lumbar curve. Use a pillow that fills the gap between your neck and mattress. A cervical pillow can be a great investment. Back sleeping supports neutral spine alignment and can help with reflux and circulation, but watch for airway issues and adjust accordingly. Side sleeping is the most popular position, comfortable, cozy, and full of benefits. When done correctly, it keeps your spine elongated and relatively straight, which reduces back and neck pain. Side sleeping keeps airways open, reducing snoring and symptoms of sleep apnea for many people. This position also supports digestion, and experts often recommend the left side for circulation and lymphatic drainage. Pregnant women are usually advised to sleep on the left to enhance blood flow to the fetus, placenta, and kidneys. The main challenge is maintaining alignment. It's easy for the top leg to slide forward and twist the pelvis. That can lead to hip, lower back, and shoulder pain over time. Choose a mattress that cushions pressure points while supporting your spine. Memory foam or zone support can help. Use a head pillow that fills the gap between ear and mattress, and a firm pillow between the knees. Hugging a body pillow can stabilize shoulders and prevent rolling. These simple pillow strategies prevent twisting and keep your spine aligned for restorative sleep. Now the most problematic position, stomach sleeping. Many experts call it the worst way to sleep. While comfortable for some, it places immense strain on your body. To breathe, you must turn your head for hours, twisting your neck out of alignment. This leads to chronic neck and upper back pain, pinched nerves, and even herniated discs over time. Stomach sleeping also flattens your lumbar curve, which can cause lower back pain and wear on the spine. Pressure on the jaw raises the risk of TMJ issues and morning headaches. From a heart and breathing perspective, lying face down can compress the chest and restrict diaphragmatic movement. If you can't stop stomach sleeping, try removing your head pillow or using a very thin one to reduce neck twist. Place a flat pillow under your pelvis to support the lower back and reduce strain. Use a body pillow to encourage rolling to your side. Actively working to switch positions will pay dividends. Switching away from stomach sleeping can reduce pain and leave you feeling more refreshed. Finding your ideal sleep position is personal, but alignment principles remain universal. Keep your spine neutral from head to hips. A medium firm mattress that supports your shape while cushioning shoulders and hips is usually best. Your pillow should fill the gap under your neck. For back sleepers, a thin head pillow and a small pillow under the knees create 2 support points. For side sleepers, a thicker head pillow and a firm pillow between the knees to prevent twisting. To break stomach sleeping, surround yourself with pillows to block rolling and use a body pillow as a transition aid. Also prioritize sleep hygiene, consistent bedtimes, a cool dark room, and a calming pre-sleep routine. Try a 1-week experiment. Sleep on your back for a week, then on your side. Note how you feel each morning. Are you stiff or sore, or refreshed and ready for the day? Your morning feelings are feedback. Listen and adjust. Making a conscious effort to improve your sleep position is one of the most powerful investments in your long-term health. Sweet dreams.